Indu Bhushan, CEO of Ayushman Bharat. The COVID-19 testing and treatment is now free. It's the PMJAY which will cover the treatment cost, and the government is essentially exempting the fee on the treatment. So let's talk about this with Dr. Bhushan. Thank you so much for joining us today on ET Now. I think this is, of course, a very welcome move. The fact that, treatment and testing is being made free under Ayushman Bharat Yojana. Let's begin by talking about that a bit, Dr. Bhushan.
It's not NHA's call. This has been a Government of India's decision to include testing and treatment under Ayushman Bharat PMJ for more than 50 crore people who are our beneficiary. And with that, the idea is that these people should not either not use services because they can't pay for it, or by using services, they should not become poor or poorer. So yes, I agree. It's a welcome step. Right now, most of the services are being provided by the government for free. And if in any unfortunate situation, we see that there's a surge and more people need to be covered, obviously the private sector will have to play a role. And when private sector is providing services, we'll be ready to protect the poor.
What sort of cost burden but this sort of a move would have, and how will it be funded, Dr. Bhushan?
See, the costing will depend on how severe the problem is, and how deep the epidemic goes in the country. And so we can't take a call on that. But I must emphasize that cost or financing is not the consideration. Our priority is to save people, and our priority is to save them without them incurring any financial cost. And whatever it takes, government will be providing those resources. At the same time, I must say that I must also inform you that our regular treatments actually have gone down a lot because of this epidemic. Earlier, we were treating about 30,000 people every day, and that number has come down to about 14,000. So about 60% decline in our footfalls. So because of that, of course, we are saving money. And so whatever it takes to cover people who need help for COVID-19 testing and treatment, we are ready to be there with them.
Okay, so that's good to know, obviously, that in terms of number of patients. But, the fact is that cases are only multiplying. So have you sought for any sort of additional sum, as a funding perhaps to deal with the increase in number of cases?
Not yet. We are starting small because, as you know, that currently all treatment is almost entirely in the government sector. And the public hospitals are not charging anything. They are providing it free. Our scheme, PMJ, will become effective only when we need private sector to provide these services, and our beneficiaries are going to the private sector. And right now, we have enough resources. And if we need more resources, we'll request the government.
How many hospitals have been impaneled under this right now, Dr. Bhushan?
Yes, that is a major issue. We are working with states to impanel COVID-only private hospitals where only COVID-19 treatment is given, because what we've seen from all over the world is that they should be segregated, standalone COVID hospitals, so that there is no cross transmission of disease and people without no COVID get infected. So we'll be working with the states to identify those hospitals. And for example, we've done that in UP. About 70 hospitals have said that they will be willing to be COVID-only hospitals. And we'll do the same thing with other hospitals as well, other states as well.
So 70 hospitals have already been finalized in UP. What about finalization of hospitals in other states? I mean, is there any timeline? By when will that be finalized?
As soon as possible, because the policy has been put in place only over the weekend, and we'll be doing it in 1 or 2 days, because, of course, we need to be ready if and when there's a surge in the demand for treatment.
So, Dr. Bhushan, have you set up any, special team perhaps for this exercise?
Not really. The whole National Health Authority is working on this because this is a major concern. So the major task for us is to ensure that we can provide services for COVID-19 patients.
So, just to understand, when can a person go to get tested? I mean, is there right now I understand there's this criteria, of course, of having some sort of foreign travel history, symptoms being shown, etc. So what will be the criteria to get tested under this Ayushman Bharat PMJ?
We are implementing the guidelines and protocols which have been decided by ICMR and Ministry of Health. We will follow them. And as you know that those guidelines and protocols have been evolving as this epidemic is changing. And so whatever the protocols are there, we'll follow them. And maybe this question should be raised more to ICMR and Ministry of Health.
Okay, now Dr. Bhushan, just to clear the air, let's say if a person gets tested for COVID-19, but the result is negative. Now, what happens in that case? Who will pay for it? Will it still be free, or will that person then have to pay?
It will still be free because the testing is free, and irrespective of what comes out of it, if it's negative, person goes home, and if they have some symptoms, they'll take treatment. If that treatment is needed, we'll cover it. If they're positive, of course, they'll need treatment, and that treatment is also covered. So testing is free, irrespective of the outcome.
Okay, what will be the paperwork now? Let's say if our viewer does want to procure and, get him or herself tested, wants access to the test and treatment, what will be the paperwork like?
Well, the paperwork which has been identified by the Ministry of Health and ICMR, we'll follow the exact same paperwork and same protocol.
Okay, but still, if you'll just explain the procedure, for the common people, just so that our viewers can understand it, basically.
For testing, there's a form which has to be filled out, and that form is signed by a doctor which is authorized, and that form authorizes the person to undergo the testing, and that form will be needed, and we'll be needing that form for authorizing the testing. And once the results come out, of course, they have to inform ICMR through laboratory LMIS, and if they're positive, they have to go to COVID-only hospital, and there's a whole protocol for that, and we'll just follow that. If they're going to public hospital, of course, that will be free, but if they have private hospital, we'll pick up the cost.
Okay, Dr. Bhushan, now what if a person does not come under the purview of Ayushman Bharat? Is he or she still eligible for Modi care?
If they're not part of Ayushman Bharat, of course, we'll not be covering them. And states may have their own plans to cover them. But from our side, we'll provide support only to Ayushman Bharat beneficiaries.
Okay. Now, we recently saw the NHA partnering with Uber to, sort of provide safe, reliable and efficient transport for India's frontline health workers who are, out there treating and engaging with COVID-19 patients. But so far, this partnership is limited only to 7 cities. So do you have any plans of, extending this to other cities as well?
Well, for the time being, no. But if there's a need, we can do that. We'll, of course, need to talk to Uber about how much they can expand. At the same time, Ola is also approaching us, and they want to also provide a similar type of support. And so use Ola for some other cities.
So is there any timeline by when you can, sort of announce this partnership?
I can't give you a timeline, but hopefully soon.
Okay, all right. Great. Dr. Bhushan, thank you then for joining us and providing so much information and clarity for all our viewers. So folks, under Ayushman Bharat PMJ, the treatment as well as the testing is going to be free, even if you are tested